Hello everyone, I'm Dr. Tejaswini Tumma, consultant medical gastroenterologist and hepatologist from Kamineni Hospitals, LB Nagar. Every year on July 28, we celebrate World Hepatitis Day to raise awareness in public about viral hepatitis. So what is this viral hepatitis? Viral hepatitis is a liver infection caused by hepatitis viruses like A, B, C, D and E. Out of these infections, all these infections can cause acute infections, whereas B, C and D can cause chronic infections. So how does these viral infections happen, or how do they spread? Usually, viral hepatitis A and E are caused by taking contaminated food or water, whereas hepatitis B and C infection happens when you take contaminated blood transfusions or from mother to child transmission, or when you participate in some unsafe sexual practices, or when you have this IV drug abuse. So, what happens when this infection occurs, or what are the symptoms when this infection happens in a person? You'll usually face frequent fatigue, malaise, fever, vomitings or loose stools, and pain abdomen. And if these infections progresses, you can also develop yellowish discoloration of your eyes and urine, which we call it as jaundice. Some people may have itching all throughout their body, and if this infection goes on progressing, they may develop like ascites, that is abdominal distension or pedal edema. Usually, acute hepatitis causes only fever, vomiting, and loose stools, and it reduces within 1 to 1.5 months. But when it becomes chronic, it may damage the liver and cause cirrhosis of liver and also liver cancer. Hepatitis B and C are classified as carcinogenic viruses that causes liver cancer. So if these infections happen to us, can we diagnose these infections? Yes. By simple blood test, we can diagnose this viral hepatitis. By simple blood tests like liver function test, hepatitis B surface antigen, HBsAg, anti-HCV, and antibodies against this anti-HAV and anti-HEV, we can diagnose this viral hepatitis. And we can do ultrasound abdomen to see how our liver is because of these infections. And patients who are suffering with this chronic hepatitis B and C, we usually do fibroscan to see what is the status of the liver. So once we diagnose this viral hepatitis, can we treat these hepatitis? Yes, there are treatments for chronic hepatitis like chronic hepatitis B and C. The good news is hepatitis C is completely curable. With the recent available medication, if we use some few drugs for 3 to 6 months, hepatitis C is completely curable. Whereas hepatitis B, we can prevent it by vaccination, and we can also treat it by drug. Previously, for this treatment of these drugs, we used to give lot of IV injections for long duration. But with the recent advances, the drugs are very minimal and also with less side effects, and for short duration, with this short duration of drugs, the complete virus can be eliminated from your body. And when you have acute hepatitis like hepatitis A, E and B and C, the treatment is usually symptomatic treatment. The whole purpose of treating this acute infection is to prevent acute liver failure. Only 5 to 10% of people may develop acute liver failure when they are suffering with this infection. So if they have this acute liver failure, it has to be diagnosed properly and in timely, and we need to go for even liver transplantation if they have this acute liver failure. So can we prevent this viral hepatitis? Yes, it is preventable by few measures. Hepatitis B has a vaccine which is very efficacious, and we can prevent this hepatitis B infection with simple 3 doses of this vaccine. And don't take blood from any blood bank. And when you want any blood transfusion, you have to take this blood from a very certified blood bank where they do all the tests for the blood before they issue the blood. And don't eat contaminated food or water. Don't eat more outside, and especially in monsoon seasons when it is raining, be careful when you eat outside. And to prevent mother to child transmission, all the pregnant women should undergo this hepatitis B and C testing. If they are positive, there are good treatment to prevent this infection from spreading to the baby. With simple injections and tablets and good follow-up, you can prevent the transmission of this virus to your baby. So it is completely preventable if you follow few precautions. So on this World Hepatitis Day, let's all pledge to get tested, get vaccinated and get treated. Thank you.